Welcome to the Secure Dynamics videocast. With me today, I have Damien Chung. Damien is the Business Information Security Officer at Netscope. Welcome, Damien.
Hi. Hi, Ashwin. Thanks for having me.
Absolutely. So, as a brief introduction, can you tell what you do? I mean, your title is obviously a little different, and talk about your role inside of Netscope.
Sure. I handle our business corporate security operations within Netscope. So that's obviously anything our users are using to develop the product, supporting them from their endpoints, making sure our data is remaining secure, and basic security operations for the business. I don't look at the product side. We leave that up to, I have a peer that does that. And obviously my boss, the CISO, Lamont, covers a lot more. But my focus really is just the business security.
Okay, so let's talk about the topic for today, which is really about healthcare SMBs. And when you talk about healthcare SMBs, I mean, traditionally thinking about maybe it's a dentist office, maybe it's a chiropractor, maybe it's a physical therapist. And the list goes on and on and on. And especially now, you mentioned the data security for businesses. What are you seeing, given your experience both in the security space, but also your past experience inside of healthcare? How do these SMBs now deal with the reality of each one of them has kind of been pushed through this digital transformation, whether they like it or not, and things are being done remotely more often than not? So talk a little bit about what that means.
Yeah, my background, obviously, I come from healthcare security. That's where most of my background comes from. And I've been the subject matter expert in healthcare security for Netscope. So talking to our customers. But we've mostly been focusing on big healthcare, like hospitals, a lot of the big providers and the big payers, like the insurance companies, big pharma. But what about the SMBs, like you mentioned? That I think we kind of tend to forget that there are thousands and thousands of clinics that support a main hospital, or these ancillary services that support the hospital, and they have security needs too, right? So I would say in the past and even today, they're probably more digitally savvy than a typical hospital because they can move a lot quicker. A lot of them start up their practice with electronic medical records, EMRs, that are already cloud hosted. We're seeing some of the larger organizations that, they're just starting to move into cloud hosted environments, but the smaller ones, the smaller clinics that may have 2 or 3 physicians, maybe up to 10, they're already into a cloud platform. And, so they've already been moving into that digital transformation because they've had to. They don't have the ability to go and buy big servers, manage a data center, and those sorts of things. And so for them, they are already in that cloud space, right? The big question is how is security different for that SMB versus a big healthcare organization? I think we seem to forget that even though we're putting data into an EMR that's hosted somewhere, are we really looking at or assessing the risk of the data that we own, that all the patient records are putting in there? So whether it be a dentist's office, a chiropractor, a physical therapist, what are they doing to protect that data as it goes in? And so some of the questions I would ask is, are you even getting that EMR service to sign a BAA? Are they going to be liable for any data that's inside of their cloud platform? And have you reviewed the documents, the security documents?
So David, let me ask you a question. So when you say have you reviewed, who would that you be in such a...
And that's a challenge, right? Because a typical small practice doesn't have a security, doesn't have a CISO, doesn't have a security team. So it really ultimately falls into the responsibility of the practice owners. So whether that's the doctor or the medical director, if they're lucky enough, they'll have a business director or an office manager who would be administrating all of these business tools, right? So this, just like any normal contract, who is looking after that practice as a business, who is making sure we have the right insurance. right?
So somebody who's doing everything but actually dealing with patients has to now kind of come up to speed on security and privacy and data protection, right?
Yeah, because that's core to what they're providing, and so now your patient privacy becomes extremely important, because not only are you dealing with their ailments, but now you have everything into one system that you got to worry about. What am I doing with? How am I protecting my patient's privacy and their health? And so it could be, the doctor now becomes a security professional or is now responsible for security. And so some of the things they may not be thinking about because they've already outsourced it to a cloud provider. But what is that cloud provider doing for you, right?
So talking a little bit about in terms of how number one, like you mentioned, they now have to become a security expert, but it's not just a one-time thing, right? So I'm in California right now, so CCPA is actually now gone into effect, right? So then some people are starting to, hey, what does this really mean? So question is, so it's not just a one-time thing where a dentist or a other kind of medical practitioner would come up to speed. How do they even, number one, keep up with these ever-changing regulations, and now with this contact tracing and God knows what the post-COVID regulations look like? Again, I mean, isn't that a challenge? And are there services that consultants offer, or I mean, what other avenues are there for these SMBs to kind of stay up to date with what's happening?
Yeah, that's a very good question. I think finding a consultant that can help you may be beneficial. Mm-hmm. But sometimes it's not even needed. I think if you have just a checklist of things that we need to cover as a provider, what should I be looking out for? Mm-hmm. And as you get put together a checklist, obviously CCPA is a good place to start. It has some defined requirements of what you're allowed to do and not allowed to do, mostly trying to protect the patient privacy. And so if you feel like you can go and get a consultant, great, but a lot of times you can't really, not in a small practice environment. It's very difficult and could be costly to get a security professional or a privacy professional to come in and take a look. And so I know that's not something that it just happens all the time.
Right.
I would start with reading regulations, and sometimes you'll find these cheat sheets online even to just help you, guide you, and as long as you're looking out for your patient privacy, I think ultimately their data, protecting it.
Yeah, so again, a great conversation. I know sometimes it can be all overwhelming, right? So people just opening up their practice, and I was talking to somebody the other day where they have social distancing rules where anybody accompanying the patient isn't allowed in, and between patients they have at least a 15-20 minute clean time. So on top of this, I'm sure security and privacy is something they have to, right? So as you correctly mentioned, I think this is no longer something that they can ignore and the
I think where they have to be careful, two areas, right? Where they're giving patient access to their own records, which I like as a patient. I'd like to go in to see my own records, but how do you verify, first of all, that the patient's going in there and not somebody else? And so can you enable multi-factor for those patients, so that making sure that you're actually getting the patient into the record and not somebody else, an imposter. The other worry is, these EMRs with small practices now have marketing functions built into them. And so now there's a crossover of I'm marketing to my patients through the same platform where I store their medical records. And we just have to be conscious of, okay, maybe this patient has checked the box to say, no, I don't want to be communicated to outside of the care that I'm receiving. Because now that cross contamination of data, potentially breaching their privacy. I'd be worried, who else is looking at my medical record? Why are you marketing to me a service? Is it because you know that I have a certain condition? Right. So those are some of the things you got to be careful of.
Wow. Yeah. I mean, I never thought of that. So really, really good conversation. And hopefully some of the listeners have takeaways from this. And clearly, I mean, this is a topic that isn't, like you correctly mentioned, isn't highlighted as much as some of the big pharmas or large healthcare organizations, right? So I'm glad we touched upon this. Damien, again, thanks for your time and stay safe.
Thank you, Ashwin.